This is Fox 5 News at 10.
Plus, RG3's recovery, details on the Skin Star surgery, his upcoming rehab, and when we could see him back out there on the field. Physiatrist Wisotzky joins us again tonight with more on what lies ahead for Robert Griffin III. Thanks so much for joining us again tonight. My pleasure. Use your model, if you would, for us to sort of explain Griffin's injury, the ACL, the LCL.
So what we knew going into the surgery was that the LCL was torn, the lateral collateral ligament. This is on the outside of the knee here, stabilizes the outside of the knee. What we were suspecting and what was confirmed today during surgery was that the ACL deep in the joint indeed was torn. Keep in mind, Robert Griffin already had this repaired while he was in college. This ligament prevents the tibia, this bone, from moving forward, and this was reconstructed today as well. Okay, let's talk about what's next. We know he's been out of surgery now for several hours. What is he going through tonight? Well, the main goal right after surgery is certainly pain control. So the earliest phases of recovery are controlling swelling, pain control, and just starting to get him moving at the earliest stages.
So what would be next in the rehab process? I mean, is he supposed to stay in bed, stay off the leg? Are they going to have him up and moving around?
They want him moving. They want him moving to some degree. Really, the first stage, as I said, is pain control, working on that range of motion, and as the range of motion improves, they can work on strength and then eventually developing more functional tasks.
As we've learned with this particular surgery, they used a graft from his other knee to fix his knee that was damaged. Is that typical? Will that slow down the recovery process because now both knees have been operated on?
It's extremely typical, and it could slow down the recovery process. He is recovering 2 knees at this point. So the first time he had his ACL repaired, they took that same ligament from the right patellar tendon, because that was already used in the first surgery, they had to go to the other side. So he did have 2 knees operated on today. The surgery on the left is, as far as orthopedic surgeries go, relatively minor, taking that tendon, but it still can cause pain and affect the recovery.
We know we've seen other professional athletes. Vikings running back Adrian Peterson came back after ACL surgery and the #1 running back in the NFL. What are RG3's chances of coming back and being just as strong as he was before he was injured?
Well, it's difficult to say, and it's certainly unfair to compare this to Adrian Peterson's recovery. This is a second surgery. He already had the ACL repaired once, and he also had a second ligament involved as well. Dr. Andrews gave a very encouraging report today, saying 6 to 8 months should be ready to start the season. There are many people that think that that may be too optimistic, and we may be looking at a return at some point in the middle of the season. Some people may say that he may not be functioning at his previous level right away. It may take some time for him to be back, the old RG3 that we knew. We'll see when he does come back. I think for Washington, D.C., the bigger issue is not a matter of when he comes back, but having him come back at full force and really hoping that he has a great longevity to his career.
I think that's what we all want, indeed. All right. Physiatrist Wisotzky, thanks so much for coming in tonight. We appreciate it.